recorded, and the recording starts now. Welcome everybody. My name is Shakoufe Zanji. I am with the Early Childhood Development Action Network. We are really pleased to host this webinar with the Countdown 2030 group, of which we are a member. I welcome everyone. We had over 300 registrants from 54 countries. And as we're seeing everyone introduce themselves, we see that, we have so many countries represented here. I'm sure people will be logging on as we go on. So today's webinar is the first of 3 series of webinars on the Countdown 2030 country profiles. We have 2 presenters, Dr. Bernadette Daelmans and Linda Richter. Bernadette Daelmans joins us from WHO. She's the team coordinator in the Department of Maternal, Newborn, Child, and Adolescent Health at the WHO. And she's one of the founding members, in fact, of Countdown to 2015. She will be presenting first, after which I will invite Dr. Linda Richter, who will present. She may not need very many introductions, but she's a developmental psychologist and a distinguished professor at the University of Witwatersrand in South Africa. She has led the development of South Africa's 2015 integrated ECD policy and the 2017 Lancet series from Science to Scale as well. And so without further ado, I will invite Dr. Bernadette to take us to her presentation. But before I do so, just a few comments about the platform itself. You will see a bar that says Q&A. We encourage you to type in your questions for the panelists in the Q&A box. If you put it in the chat box, it may get lost in all the other chitter chatter. So we encourage you to put your questions in the Q&A. For the chat, we encourage you to select all panelists and attendees so that everybody can see your introduction, see the country you're coming from. So we encourage you to chit chat there, talk to each other, connect with each other. That's a place for you. So with that said, I will turn it over to Bernadette to take us through an introduction of the Countdown 2030 profiles. And again, this is the first of 3 Countdown 2030 profile webinars, and we'll go over the details of the other 2 at the end of the webinar. We'll begin with Bernadette. We'll have time for a couple of questions and answers, and then Dr. Richter, and then we'll have a discussion together. Thanks, everybody. Over to you, Bernadette.
Thank you, Shakoufe, and good morning, good afternoon, and good evening to everyone. I am going to share my screen with you, and while I'm doing that, I just would like to verify, is my voice clear?
Very clear, Bernadette. Thank you.
All right. So what I'm going to do in the next few minutes is a brief introduction, which will serve as a preamble to the more substantive presentation that Linda Richter will do. I have 6 slides, and in the first 3, I'm going to give a brief overview of the Countdown to 2030, where the initiative started and how it has evolved over time. And then in the next 3 slides, I will switch to nurturing care and in reminders of that concept that was first launched in the 3rd ECD Lancet series and then taken forward in the roadmap that is the nurturing care framework. And we are doing that because, as we will see later when we talk about the profiles, the understanding of what the nurturing care is and how the nurturing care framework is organized will be very important. So let's look first at the Countdown. It's an initiative that's actually quite mature. It started in 2000.
Sorry to interrupt you, Bernadette. We don't see your screen yet. Would you be able to share the PowerPoint?
Hold on. What is the reason? May I just restart and see?
Sure, or I can share on your behalf as well if you would like.
Okay. Share screen. Otherwise, yes, please do, Shakoufe. I don't understand why it wouldn't come up, but please do.
No problem.
Is it visible now?
That's it. Thanks, Bernadette.
Yeah, so Shekufe, yes, let's see. So countdown, you can move to the next slide, Shekufe. So briefly in terms of the countdown, what it represents, as I mentioned, it's an initiative that started a good 15 years ago out of a concern in the community concerned with children's health about the Millennium Development Goals and was the world going to reduce child's mortality in a substantive way. The interest of the countdown as it was conceived was to say if we can bring data together that illustrate our progress, then we really will have tools in hand that promote advocacy and accountability. Over the years, the countdown has expanded. So from an initial focus on child survival, it expanded to an agenda of maternal newborn child health. And as we will see in current times, we have many other components attached to it. So the mission as it stands today is to look at evidence for advocacy and accountability on child survival, maternal newborn health, reproductive health, to bring elements of health systems and policies with data around coverage of interventions, and to look further into the sphere of early childhood development, adolescent health, and nutrition as kind of areas that really fit with the way we look upon women, children, and adolescent health under the Sustainable Development Goals. The focus of the countdown is really to track progress in countries, looking at effective interventions and their coverage, disaggregating information to look at equity profiles and to see where are these most vulnerable areas and populations that may not be reached with the services or the interventions that they need. And then, as I mentioned before, put that in a context of health system strength. What is the health system providing to make coverage and quality happening? And what are the policies around that in countries that create this enabling environment? The focus is then to create evidence-based action that is based on data, and through that create accountability mechanisms that really speak to what is responsibility of national governments, but also speak to the role of civil society, implementation partners, a whole range of stakeholders that collectively are responsible to move the bar. So when we look at countdown, it's really an endeavor of partnership. And as you may later see on the website, you pick up a countdown report, you will see that many partners are engaging around this initiative. And they come from academic institutions, from UN agencies, partnerships such as PMNCH, and as Shekufe mentioned, ECDAN is there, the International Parliamentarian Union, the IPU is also a part of this partnership. And so what is then the countdown generating? So over the past 15 years, we have seen 8 global reports being produced that contained country profiles, for each country a detailed country profile, and you see a small example on the illustration in the slide that brought together these indicators around intervention coverage, the health system environment, and the policy environment, and gave equity analysis around that. And so beyond the individual country profiles, there was then analysis that looked at both global and regional progress. And as the countdown started moving from this initial illustration, which was unique at the time to have sort of for a country on one page, a key set of evidence-based data, it moved forward not only in creating scientific publications around the analysis, but also started engaging deeper with selected countries to analyze why was progress made, or what may be barriers that would prevent progress. So really the advances in terms of equity analysis, coverage, and the measurement thereof became a focus of Countdown. And so this is a story that fits very well with our current context, where the Sustainable Development Goals ask us to go beyond survival, where coverage remains and equity remain very good proxy measures of progress towards both reduction of mortality as well as promotion and attainment of health and development. But we are also seeing that over the years, the effort has been shifting positively from more sort of a global perspective to a real perspective of saying, where is that capacity in regions and in countries to use this work, but also to create and generate more information. And so that brings us to the next slide, where we are talking about collaboration with institutions. Next, Chikufe. So here on the next slide, has that appeared on everyone's screen? Yes, okay. So you see some examples of the regional initiatives that are firmly engaged around the Countdown. So in the Latin America region, we have the University of Pelotas in Brazil that is really working with 10 countries to look at issues related to equity and addressing ethnicity within RM&CH there, with one in-depth case study in Haiti. In West and Central Africa, the Health Organization there is working with 15 to 20 countries, and they are looking at the continuum of care and equity. And in East and Southern Africa, the Policy Institute that is in Nairobi, Kenya, is working with 15 to 20 countries again to look at the same issues and really bringing together experts locally to strengthen that analytical capacity in countries with and for ministries of health, with the aim to make data drivers of progress. Next. Chikufi, next slide, please. So in summary, as we look at the mechanisms or the logic framework around the Countdown, we can see that there are the mechanisms of the steering committee, technical working groups, coverage, equity, drivers are three of the core groups, and thematic groups around early childhood development, adolescent health, women's, children, and adolescent health in humanitarian settings or conflicts, and nutrition that are coming on. And I have just spoken to the regional initiatives. I've illustrated sort of how the reports, the publications have been a main channel of communication, but how increasingly that element of capacity building in countries is becoming important. And so as a result of this, and the objective, linked to the objective, is the improved monitoring, the enhanced measurement, research and learning, and improved capacity where it matters at the front line to really generate and use data. And so overall, we hope that with that, we provide the ingredients that motivates and catalyzes action. So far, the little introduction to the Countdown, and as you will hear from Linda, you will hear many more details on how in practice these concepts have been translated to the field of early childhood development. Chikufi, can you go 2 slides back? Here we are, thank you. So I'm now moving to nurturing care, and will introduce 3 leading concepts within the nurturing care framework that, as I had said before, emanates from the evidence that was put together in the 3rd ECD Lancet series that had its title Advancing Early Childhood Development from Science to Scale. The 5 components, I hope that many of you on the call are very familiar with this. And so what we are showing in this slide is to say what is sitting under these components. So you will see in health, nutrition, security, and safety a list of interventions, many of which that we are familiar with, but packaged in a way that reflects what children need to develop, both physically as well as mentally, and that kind of builds on an ongoing agenda but enhances it. And so some of these enhancements come with components of early learning and responsive caregiving that maybe traditionally in many settings have not been part of the menu of essential interventions that drove the old MDG agenda, but are now becoming increasingly important as we look at a broader sustainable development agenda. And we not only recognize survival, but we recognize the importance of developing human capital. So as you look at these slides, you will see when Linda presents that sort of sentinel issues that are reflected here in this slide are taken out and translated into indicators, because that's how the link between the 5 components and what the ECD countdown can do is being made. Next. Next, Chikuve. So in this slide, you will see the second concept, and that is how can we make nurturing care happen? Clearly, within the Lancet series and the nurturing care framework, it's articulated that this comes from an interaction between the child and the primary caregiver. So the family has a very central role to play. But beyond that, it's the strength of the community and the way they are empowered. The role of services, and in particular health in the early years, but other services like education, child protection, social welfare that have a role to play, is how can individual services support families to provide nurturing care, and then the need for enabling policies that provide families with the time and resources to give nurturing care to young children. So here again, we have a range of issues in the policy environment like national minimum wage, health insurance, affordable childcare that are kind of these primers to say, as we move forward in programs, we would like to see such policies in place being implemented. And so we would like to have measurements that give us a sense, is this really happening? Similar for services, where we can look at coverage for interventions, and then as we go a level below, there are more the programmatic inputs that may be needed and that eventually we would like to get a handle on as well. Next. And then finally, there is the concept of saying leaving no child behind. Because as much as we realize that all families may need some support, some families need all the support they can get. So within the nurturing care framework, there is this 3-tiered approach of saying universal support for everyone through routine healthcare, childcare, and other services, including media outreach. Targeted support for families and children at risk, and so being able to define, to say who are these populations or families, whether it's children who are born preterm, children who are stunted, community families that are affected by HIV, communities where violence is prevalent. These are some of the issues we want to understand in order to see where targeted support may be needed that is a follow-on on the universal support and provides extra mechanisms for reaching those families. And then clearly there is the level of specialized support for those children and caregivers where there are developmental difficulties, where there may be a maternal mental health problem, or where a child has a disability, where additional care is needed. So as we look at monitoring, again, we would like to have sentinel indicators that give us an idea what is happening across these 3 levels and how far have systems evolved in order to respond to the concept of leaving no child behind. With these few words, I like to leave you. I hope to have given you some food for thought, and Shikufi, maybe a few questions for clarification, but then I have a sense that Linda's presentation brings this all together in a way that it becomes alive what the ECD countdown is.
Thank you so much, Bernadette, for giving such a useful overview of who Countdown is and what that process is, and also giving us an overview of the nurturing care. So now is the time, if there are any questions, to type them in the Q&A or raise your hand and I'll let you speak and you can ask it directly. So we'll just give 10 seconds or so for any questions for the overview on Countdown 2030, as well as the nurturing care framework. I think that was really clear, Bernadette. Thank you so much. Over to you, Linda, to take us through now the overview of the actual profiles themselves. Oh, 1 second, we have a question from Melanie. All right, go for it, Melanie. I'm going to unmute you. Are you able to ask your question, Melanie? Okay. All right. Well, Melanie, you can type in your question. I've let you speak if you wanted to speak. All right, let's move on. Melanie, please do type in your question in the Q&A chat box. Let's move on to Linda. Take us away, Linda.
Good. Thanks very much, Shikufe. Can you see my slide?
Yes, we can. Mm-hmm.
Hello, everyone. I was just delighted as the names rolled in on the introductions to see so many people I know, and also how many people I didn't know and glad to meet. So welcome, everyone. And thanks very much to EGTAN for hosting these webinars. So I'm speaking here today in the first of the 3 series on the countdown, the Early Child Development Countdown. I'm speaking here as the chair of a joint technical working group, and there are a number of members of the working group online today, and I hope if we have questions, they will come in as well. Now, I just want to take you back. I don't seem to, oh, there you are. I just want to remind you about our footsteps to how we got to where we are now. I often use this sentence that if you take from the Lancet 2007 series, the 2011 series, and then to the 2017 series, that more than a century of developmental science was brought together in these 3 Lancet series, and jointly have made the impact that have brought us to where we are now. Now, the last Lancet series, the 2017 one, Advancing Early Childhood Development from Science to Scale, is where we introduced the concept of nurturing care. Now, it comes up in the second paper, but it was a term we debated over quite a long time, and all 50 authors of the 3 Lancet papers agreed on this term. One of the tasks we had set ourselves, because we had done a political analysis of what might be barriers to ECD being expanded and taken to scale, one of them is the confusion in terminology about what ECD is and what nurturing care is. So in a way, this concept of nurturing care was aimed at trying to clarify that nurturing care is what children need. Early child development is the outcome. It is what happens to children. So the concept of nurturing care was very important to trying to advance understanding that these are the inputs, early child development is the output. Now, the nurturing care framework, which was developed by UNICEF, WHO, and the World Bank, and the country profiles, and this is a picture of the cover of the country profile report, were developed at the same time and jointly together. Some of the questions that were sent into Shekufe were questions that pertain to older children. So perhaps just to clarify that both the nurturing care framework and the country profiles apply to younger children. Now, we have tried to finesse this definition of what younger children are in many ways. The Lancet series refers to children 0 to 3, the nurturing care framework to 0 to 5 and even to 8. But this is to do with younger children, so questions around whether we were including indicators of older children need to take into account that the focus here is on young children. As Bernadette said, one of the important things about the nurturing care framework is that it's expressed at 2 levels. One is the components of nurturing care, what children need to develop their potential. And these components require inputs from many sectors. On the other hand is the social level, and this describes the enabling environments that promote nurturing care, or hinder nurturing care. This is a multi-level environment, a sort of ecological framework. Now, the first set of country profiles were published in 2018. They were launched at the same time as the Nurturing Care Framework, and those profiles covered 91 countries. The second set of profiles, where we upped our game quite considerably because UNICEF became the publisher of the profiles. The second set of 138 profiles was launched in New York during the United Nations General Assembly in September 2020. Now, this is what the country profiles look like. I chose Bangladesh. Shekufe, that was for you because you have married somebody from Bangladesh, and I chose South Africa because that is where I'm from. As you'll see, we have organized the country profiles in a way to specifically reflect the Nurturing Care Framework. Now, there is no data reflected on these country profiles that is not publicly available to anyone. So if you go onto the WHO website, the UNICEF website, the ILO website, the UNESCO website, the World Bank website, you will find all of this data. What we've brought to the fore is the organization of the data in a way that makes sense within the Nurturing Care Framework. So if you look at the top, we have, as it were, contextual information on the demographics of a country, such as the number of children under 5 years of age. Next to that, we have put threats to early child development, which include losing your mother, being born at low birth weight, growing up in extreme poverty, being exposed to violent discipline, being born to a young mother under 18, preterm birth, under 5 stunting, and inadequate supervision. In the next line, we have tried to bring in some broader concepts. So the first horizontal set of bars, young children at risk of poor development, reflects three time periods, 2005, 2010, 2015. And that indicator is the one that we published, that was first published in the 2007 Lancet series, and that we republished and recalculated in the 2017 series. And that is the number of children who are exposed to extreme poverty, that is less than $1.9 per day, or stunting. So that gives you an idea. In Bangladesh, for example, you've seen a decline in children at risk for poor child development from 65 to 45%. Then we have risks by sex and residence. This is, if you like, our equity measure. And then we have lifetime costs of growth deficit in early childhood. So this is some work that Gunther Fink did and published, which takes growth failure in early childhood, looks at the implications of growth failure for education in that specific country and the loss of wages to a particular country of poor growth and subsequently low education. Then we have the components of the Nurturing Care Framework, and under each component, health, early learning, nutrition, security and safety, we have selected indicators from the available data that we think reflect services to which a child is being exposed. Now, you'll see that responsive caregiving, we have no data yet. And several of you have asked questions about that, and perhaps we'll address that later. And I hope somebody will raise that again and give me the chance to talk about that. Lastly, at the bottom, we have facilitating environments, and we have selected 2 kinds of data to reflect this facilitating environment. The one are international conventions, which are recorded in the UN Convention database, and the other are policies. Most of them are actually contained in the ILO, the International Labour Organization database, but the international code is maintained by WHO. Now, all of the data here derives from usually the demographic and health surveys or the multiple indicator cluster surveys conducted by UNICEF. With respect to the policies, this is data that ILO checks, that is submitted by governments, but ILO checks. And there is an interesting issue here that we need to address. So all of this data is asked in a standardized way in these nationally representative questionnaires and answered in a standardized way. And that is what enables us to put two countries side by side and compare them, because all the data here is comparable. So the question came from Kenya, and this is true of many countries, that their paid maternity leave is marked red and their paid paternity leave is marked green. And the question is, why is that? Because they do have maternity leave. Well, the issue is that because these are defined according to definitions within the databases that we have the standardized data on, paid maternity leave refers to 100% of the wage for 14 weeks. Paternity leave currently refers to any paid paternity leave. And so you have this distinction. Now we are alert to the fact that this inconsistency is confusing to people, but we will address it in the next iteration and see if we can't get a better indicator of paid paternity leave. At the moment, there isn't really a more defined one, but perhaps one will emerge. With respect to the paid maternity leave, the ILO uses this criterion of 14 weeks of fully paid, 100% wage replacement, according to the Convention 183. So, for example, many countries might have paid maternity leave of 50% wage for 6 weeks or any other kind of time period or wage percentage, but it doesn't conform to the ILO criteria. So these, how did we select the 91 countries? How did we select the 138 countries? Well, the first set of 91 countries were selected because they aligned with the broader countdown effort with the countries that Countdown was monitoring. But it also referred to countries that had more than 30% of children exposed to extreme stunting, extreme poverty and stunting. And this included the very large countries like China and India. By the time UNICEF took over the production of the profiles, which is what the second set of profiles is, we've gone to 138 countries. And this is all low and middle income countries with available data. That is countries that have a DHS or a mix since 2005. So that is why some countries are in and some countries are not. Now, several people asked questions about why certain countries were in or out. Somebody asked about Fiji, somebody else asked about Colombia. These countries are in the country profiles and we will help you to find them on their URLs. So this is how the data is organized. As I said, we have the demographics, we have the early childhood development outcomes. We actually have included in the more recent version of the profiles the ECDI, which is the measure of 2.4.1 in the SDGs. We have threats to ECD, we have nurturing inequality, we have nurturing care, health, nutrition, responsive caregiving, and so on. Now, as I said, the data comes from nationally representative country surveys. There are 2 or 3 indicators, I think, where we have derived the data from published peer-reviewed articles that include country data. So the country data is public. Countries could contest it. And the data is fully transparent and available, usually as a supplement to the main paper. Now, there are some papers that we are considering whether we want to include. For example, there was a very good paper by Olusanya in 2018, looking at disability amongst children under 5 years of age and giving country figures. There are some questions about what the range of disability that is covered in that paper, but this will come to the technical working group who will discuss, should we include the data from that paper into the next version of the country profiles. The country profiles are updated every year, even though in a year, several countries, maybe 12, 15, Claudia Kappa will help us from UNICEF, may have done a DHS or a mix during that year. There is an inevitable time delay between, say, when a demographic and health survey is conducted in a country and when the data becomes ready for inclusion in the UN and other databases. So there's a lot of checking, there's lots of going back and forth with countries to ascertain that the data is acceptable and correct before it actually comes into the form where we could use it on something like the country profiles. The important thing is that the standardization of the data. So many people have drawn our attention to the fact that one or other country has a violence survey or some other particular survey and want to know why we can't incorporate it into the country profiles. Well, if other countries have not asked that question in the same way and coded the answers in the same way, then it's just not easy. We can't do it. We can't compare that data with any other country. And the purpose of the country profiles is, in fact, to get a global picture, a country picture, and a regional picture of the situation of young children in terms of nurturing care and early child development. So all of the UNICEF, WHO, UNESCO, and the World Bank update their data when the new DHS and mix become available. So this is just some data that Claudia extracted very nicely for the launch, showing some interesting statistics from the country profiles as they stand. For example, at the top left, in almost half of the countries with data, more than 3/4 of children between the ages of 1 and 4 experience violent discipline. Near the bottom left, fewer than half of infants under 6 months of age are being exclusively breastfed in 2/3 of countries with data. Bottom right, attendance in early childhood education is below 50% in 3/4 of countries with data. So these are a summary of some of the global findings, and we have extracted them in many ways for communication. For example, 25% of children under age 5 are stunted in nearly half the countries with data. Or attendance, this is attendance in early childhood education is below 50% in 3/4 of countries with data. Now, we have also analyzed this data in other ways. So using the composite burden risk, which is the exposure of young children to extreme poverty or stunting, taking the figures from 2005, which were published, which we recalculated for the 2017 series, Lancet series, the figures for 2010, which were included in the Lancet series, and the update that we did of 2015 figures, which were published also in the BMJ. You can see that if you look at the red blobs on these maps, you will see that red blobs are countries in which more than 2/3 of children are exposed to extreme poverty or stunting. And you can see there's been a marked improvement across countries from 2005 to 2010 to 2015. And that's largely because poverty declined during this period and stunting declined in several countries with very large child populations. But this gives you an idea of how we can look across time and across the globe at how young children are doing, or how governments are doing for children. Here's another illustration. This comes from a paper just recently published. And in our efforts at contributing to the countdown generally, we have started to focus on inequity. And this paper is looking at inequalities in early childhood care and development in low-income countries, looking at the ECDI, at a proportion of children attending early childcare and education, and looking at children receiving stimulation in the home, the questions on early child development in the multiple indicators cluster surveys of UNICEF. Now, we looked at these 4 indicators by a number of parameters: wealth quintile, urban rural residents, and regional country categories of low income, low and middle, low middle, high middle income. So if you look at this country, you'll see, if you look at this graphic, you'll see right at the top, Afghanistan, Chad, Central African Republic, very few children have access to early childcare and education. and therefore the difference between poorer children and richer children is quite small. However, as countries get better off and more children get access, you see the gap between poor and rich children widening, and this is largely due to private provision of early childcare services and better off people being able to access them. And then you see at the really bottom end, or the top end, we should refer to it as Belarus, Jamaica, and Laos, you have high numbers of children having access to early childhood education in many of these countries provided by government, and therefore you find less of a division between, or less of a gap between the richer and the poorer people. So we have this data. It is not perfect. There are very large numbers of countries that don't have the data we need. So if we look at child poverty, it's only 50% of countries that have this data. Violent discipline, only 56 countries have, sorry, it's not percent, it's actual numbers of countries. The early childhood index, and you see this, it's graphed down on the available data and on the side as a graphic. All of this information on how many countries have data on a particular indicator are contained in the technical report. Now, all of this data is available. It is prepared for this publication by the Data and Analytics section of UNICEF, and I'm glad to see that Claudia Kappa, who led this, these preparations, is on the line. It's in collaboration with this technical working group that I chair, that I introduced at the beginning, and these are conducted on behalf of EGDAN, the Partnership for Maternal Newborn Health, the World Bank, UNICEF, and WHO. Profiles, the technical report, that is all the technical data, as well as the actual country data, can all be downloaded from the Nurturing Care website and the Early Child Development Action Network website. These are specifically the Nurturing Care for Early Child Development country profiles. People who are interested in the broader country profiles of Countdown 2030, reproductive, maternal, newborn, child and adolescent health. These are available at the URL given there, which is countdown2030.org, and into the country profiles. So I'll stop there and happily answer any questions or have discussions with participants on any issues they'd like to.
Thanks so much, Linda. That was fantastic. So we have a whole bunch of questions, and I wondered, Linda, if we can first start with some of the basic clarification questions that have been asked. One question that I want to get your focus on is, could you please expand on the equity dimension in terms of gender? What does risk by sex consider? What data is used? So if we can just clarify that, I believe that was one of the dimensions of the Countdown 2030 profile.
Right, yes. That on the Countdown profile, that particular indicator refers to the composite burden risk calculation. That is the number of children exposed to extreme poverty or stunting. And I know it's a surprise to people that there are not great gender differences if you look across countries, and also that in some instances, boys are disadvantaged compared to girls. And this is counterintuitive to some people and raised, but if you look through all the country profiles, if you flick through, you will see that there's very little difference between boys and girls on exposure to the composite risk of extreme poverty or stunting. On the other hand, the differences between children in rural and urban areas is very high, reaching up to 40 percentage points in some countries. So one of the conclusions we drew in the first paper on the series, and also in the second paper, was that the concentration of our efforts really have to go to rural families, poor rural families, even though there is a shift in poverty to urban areas in countries with very large urban populations. But currently, as the profiles are, and some of them are up to 2015, the concentration of children at risk is really in poor families living in rural areas in sub-Saharan Africa and parts of South Asia.
Thanks, Linda. Linda, another clarifying question is around, let me see, can we get a definition of children attending ECE? How is that calculated?
This is a very complicated issue. On both the DHS and the mix, this question is asked as it's stated. Does your child attend an early childcare learning? I don't have the exact wording here. Claudia might have it at hand. Now, knowing the South African General Household Survey very well, this question, when subject to cognitive testing, is differently understood by many people. It can refer to daycare, it can refer to home care, it can refer to a creche, a nursery school. This distinction is not carefully made in the DHS and mix. And last year, a number of us, including Claudia and Chunling Lu and others, attended a meeting with USAID, amongst which we requested that greater definition be given to this question. As it stands, it is taken at face value as a child who is attending, according to the report of the informant, who is often a woman living in the household, familiar with the people in the household, often the mother of the child, who says, my child is attending an early childcare or education program.
That's great. Thanks, Linda. Corey, I'm going to let you speak. I know you have submitted a few questions, so maybe if you could just introduce yourself, where you're calling from, and very succinctly share your questions, that would be fantastic. Thanks, Corey. Corey, are you able to speak? Okay. In that case, I will ask your questions for you. Corey asked, again, I know, Linda, you covered what the data sources are, and he's asking, or she or he, I'm not sure, is that available on the site? I believe it is. That's a question that's there, and would also be helpful to show the definitions for each of the data points under the country profile on the site. So again, that one, all the definitions are in the file themselves, but did you have anything else to add on those points, Linda?
No, of course, we always have to make a choice between giving too much information and overwhelming people. So you can, as I say, go into any of the United Nations organizations' websites, and there'll be databases where you can find all this information. But what we're trying to do with the country profiles is actually portray a rather simple and clear picture of the situation of children in a particular country. But in the report, in the technical report, the definitions of every one of the indicators are given, as is a table showing the most recent data points for particular indicators. So, for example, play with objects at home. That data comes from 47 countries with mix between 2005 and 2016. So that data is given in the technical report. And I think Claudia and I will be covering the technical aspects of the data in the second webinar. People who are interested in the data are very welcome to download the report, the actual data set that feeds into this into these country profiles on the websites.
Fantastic. Thanks, Linda.
Claudia, do you want to add anything?
Yes, Claudia, I've promoted you to a panelist in case you wanted to say hi. And Linda, if you're able to show your video, that would be great so people can see you as well. But Claudia, did you have anything to add to that? I know we'll have a second webinar that will do a deep dive into the data and the methodology of it, which is great. A lot of the questions are around that, so there's great interest around it. So that's fantastic. Claudia?
Yes, thank you very much, Shakuf, and thank you so much, Linda. Yes, indeed, I just wanted to mention that I'm taking notes of all these questions, and in the next webinar about data, we will go over all these points. Of course, as Linda was saying, there is limited space in terms of how presenting all the detailed information, but in the upcoming webinar, we will also gather suggestions on additional data that you would like, or at least information about the data that you would like to be included in the next iteration of the countdown profile. So I look forward to having the opportunity to discuss this in more details during the next webinar. Thank you.
Thank you, Claudia. The next question, Linda, there's a whole series of questions around special populations and what are plans for including them, children with disabilities and, you know, fragile contexts, all of that. So I'm wondering if you can kind of take that bunch of questions and have a response to that.
Right. As I said, there's been a real concern to represent disability because of its importance to young children and to their families. And we need a standard data set. And at the moment, the paper that I referred to earlier, published by Olusanya et al. In 2018, and I think it was Lancet Global Health, is an analysis of the burden of disease data, gives country level data. There is a question about the definition of disability, which it covers largely quite serious disability and doesn't cover a softer spectrum of disability. But when we brought out the first round of country profiles and even the second, we were very concerned to do what was perfectly acceptable, that had been vetted by countries, that we weren't putting out any kind of flaky data that would be subject to questions. I think now we've got a foothold, we can start to look at certainly what disability data is available. There's been a really strong call for representing maternal mental health. And there are some data, some published papers estimating the prevalence of perinatal mental health, which would be maternal mental health in the time period that it would affect young children. Now, with respect to groups of countries, such as countries in fragile, or groups of countries that are fragile, there's been a really interesting reaction from several of the regions to want to look at their region in more detail. So, or just to make sure that their region is looking at their countries together. So, for example, the Middle Eastern Arab countries have recently bringing out a Arabic version of the country profiles for the, I think it's 15 countries in the region. Eastern Europe is exploring bringing out a regional profile of countries that will represent also some of the particular issues that are prevalent in their area, using standardized questionnaires, particularly around substance abuse, for example. Latin American countries are talking about bringing out a profile perspective on their countries. And one of the things that I think the technical working group would like to do quite quickly, although we don't have any kind of financial support right now, and need to raise it, and we are beginning to raise it through a big research grant we've got, is to do regional analyses. So that would be definitely the next step, is to do some regional analyses, and also to do some analyses of countries, and that would include countries in fragile states, countries that are fragile. The other thing we're very keen to do is we're now in a position where by the time we had published the equity paper, we had 17 countries that had repeat DHS or mix within the time period. So we could actually make comparisons between the first DHS or mix and the second. With the DHS and mixes that have come in this year, when they become available to us, we'll have a bigger number of countries, and we can then begin to explore much more which countries have improved a great deal during this time period, which have not. So, for example, there are 1 or 2 countries where early child development care and education is improved by more than 30%. So what is it about those countries? What happened in those countries? So we're also intending to do some country case studies that would help us to understand why perhaps there was a quite dramatic improvement on a certain indicator, or why some indicators stood still when the majority of countries actually improved.
That's really great, Linda, and very helpful, and kind of speaks to the questions about what's being planned in terms of analysis and what we can learn from that. I want to turn our attention to the big elephant in the room, which is responsive caregiving, and the big question mark here. And there are a few questions that are streaming in about responsive caregiving. What data is being used for that? Are there any indicators that we've agreed to? What are plans for, turning that question mark into actual comparable data? So if we can just take all of those responsive caregiving questions.
Okay, nobody's more eager than me to see that particular component have some data in it. And we have now a big step forward. For those of you who don't know, WHO is on the 6th of March next week going to be launching their guidelines to improve early child development. Now, for those
on the 11th of March, we'll have the 6th of March, but it's on the 6th of March. But on the 11th of March, we'll be having a webinar with WHO to share the guidelines as well. So that is calendars.
So for people who are familiar with WHO guidelines, these are the guidelines, for example, on infant feeding, care of the newborn, feeding in HIV context, etc. These guidelines are produced on the basis of a very extensive and very rigorous review of literature. And the guideline on to improve early child development is joining this group of well-respected guidelines. Now, being from a region of low and middle income countries, I know that our countries don't always have the resources to actually do the research or bring the research together to provide local standards. And so when these guidelines come out and they help to prioritize and for governments to allocate resources better in their effort to get better health outcomes, they're quite quickly adopted. They're welcomed and they're adopted. So I'm hoping, and we're all hoping, that these WHO guidelines on early child development are going to be widely accepted and widely used. Now, what they do is they provide this rigorous review of interventions. Their conclusion from the rigorous review is that the evidence is moderate, i.e. that interventions to improve responsive caregiving and early learning are effective and can be shown to be so in measurements of children's development. And the recommendations that WHO has given to these is that these recommendations are strong, that we should be doing more of it. In the guidelines are descriptions of the interventions in the review of the literature. They're interventions which encourage, recognize, coach, demonstrate, praise efforts by parents which are responsive to children's communications, enable children to reach for objects, to learn, to gain independence in terms of sitting, walking, pulling to stand, and so on. So all of these are recognized in these the interventions that are reviewed. So I'm hoping that by the time the next country profiles come out, we'll be seriously discussing which countries are actually beginning to measure this, whether the process of getting something into a DHS and mix is a very long, it probably takes 5 years, whether we can start to have something rigorous enough through early country explorations and pilots and things like that, which will give us the data, that we will be starting to move towards a real measure of this. Of course, there's also a number of trials going on that are looking at the impact of public communication on early child development, most specifically one led by Betty Kirkwood in Burkina Faso, where a communications intervention actually was associated with a reduction in child mortality. This is now looking at how a communication strategy would affect early child development. So although we don't have anything in those components yet, all hands on deck to get this done. This is a really important piece.
And Linda, just when can people expect a next iteration of the country profiles? How often will they be published?
Claudia will give more details, but the decision of the committee was the working group was to update once a year. So then between 10 and 20 new surveys become available. and they will be updated electronically on the website. Producing the actual paper versions is expensive, so unlikely to do that except for perhaps special events where there's real occasion for advocacy and so on. But annually they will be updated. The data will be updated.
Fantastic. I want to turn our attention to Wahidini. Hakeem, are you able to speak and ask your question? Wahidini? No? Okay. I will turn to Matthew Frey. Matthew, if you want to ask your question.
Yeah, thanks. Thanks. Can you hear me, Shikufe?
Yes, hear you.
Great. Well, thanks, Linda and Bernadette, first for your continued exquisite leadership of this work. My question really speaks to, now that we're sort of 2 years into the launch of the Nurturing Care Framework itself, and given what we're learning about the specific things that governments can and should be doing to strengthen systems and services, specifically to introduce the framework. Can you describe what's being done and how important you think that is, and whether that could eventually be incorporated into the country profiles? The monitoring and tracking of government introduction of some of these core elements to realize and make progress in introducing the Nurturing Care Framework at a country level.
Thanks.
I'm going to leave that to Bernadette to answer, and if she wants to leave something to me at the end, I'll add.
Thank you, Linda. Thank you, Matthew, for that question. Clearly, this is a question that pertains to next generation as the ECD countdown evolves of the issues that we may want to look at. I recall out of the days when we started with the countdown, one of the questions was, for example, which countries do have the evidence-based costed plan for reproductive maternal newborn child health. Was an indicator that had attributes of uncertainty with it, because the way we were collecting the data was hard to standardize, but over time we got better at it, because as you measure more frequently and you get the source documents with it, you are able to respond to some of these questions. So that work, as Linda mentioned, WHO is sort of looking at the policy arena for women, children, and adolescent health, where the ECD agenda fits, has now crystallized in kind of a global effort and database, a repository of policy data that will be periodically updated, where the profiles can draw from. And so as we look in the future, we need to think about a tracking mechanism to get some of this information that you're asking about in a reliable way. What are countries doing in the uptake? And then kind of develop an indicator around it that has standardized elements that we say for a report, a yes or a no, or whatever measure we put around it, that we know which elements were counted and which not. So this is part of what a countdown working group can also do, and that is explore where are the gaps and seek to catalyze responses, either because the group can deal with it themselves or because they can stimulate research to take place. And I would think the indicator around responsive caregiving is one where we may reach a moment that we should pull together everything we know through research and see how this can be translated into something that can be done in a relatively simple way through population surveys and other means.
So Matthew, the one indicator that we're very keen to include is the number of countries who have adopted an ECD policy instrument. Now, there is a difficulty of relying entirely on country reports. Those of us who work closely with governments know that a country report might well be completed by a clerk in a government department, and often is not fully reflective of the situation in the country, not fully usually informed by all the things that are happening in the country. And so we have got some data on which countries have adopted an early child development policy. There are also academics working on this who are collecting data on validating that. So with, actually collecting the policies or the policy instruments and actually checking when they were promulgated, when they were adopted, what state they're in, and so on. And as soon as we've got a more a confidently valid set of data on which countries have and have not adopted a policy instrument, that's something we really do want to include. But you know, my example illustrates the difficulties of relying entirely on government reports of progress, etc., because these are, you know, these, in order to compare, you know, South Africa and Kenya, we'd have to know that governments were basing their report on exactly the same criteria, the same definitions of what we were asking about, and so on. And that needs quite a lot of work before we get to that point.
Thank you. Matthew, any response, any further thoughts on that?
No, thanks. That was excellent. Appreciate the answers.
Matthew,
Thanks.
can I add one thing, please, Shekufe?
Please do.
Things that Countdown has done and that we would very much like to do is do case study country reports. So, for example, we have seen in this comparison of countries that had earlier and later surveys that there are countries that merit some special investigation because they have leapt forward on a particular indicator, for example. Now, when we undertake a country case study, then we would be able to draw in a lot more data. I mean, for example, the work that is being done with health services to integrate early child development programs into the health services. And so we mustn't put that off the table, that even though we're looking for globally comparative data, case studies and country case studies and regional case studies are a very important part of the knowledge base.
Go for it, Matthew. You wanted to add?
Thanks. I mean, as we think of nurturing care as a movement, and I think you've worked very hard over a sustained period of time to create a movement. And I note that ECDON recently in their newsletter pointed out that 35 countries have introduced the nurturing care framework in some way, shape, or form. I do think that some specific tracking of the framework's introduction would help put political pressure on governments and would enhance the efforts of all of us. So I do think this would be an important piece for us to put in place sooner rather than later.
Sure. And some of those are highly politically significant. You know, when Mexico adopted the nurturing care framework for its entire education system, that's a very strong motivator.
And maybe, Linda, you know, just to speak of the third webinar we had talked about was doing some country examples of what, how people are using the profile. So we can address that question there as well. Just speaking on the series of questions around advocacy and action, and people want to know how this is being used in policy advocacy. I have a question from Thomas from Kenya, Kibera. He's asking about media outreach and how, you know, what are plans, what do we do? People really want to know how this has been used and how they can engage and participate furthermore.
Right. Well, this requires, as Matthew says, a movement, so everybody plays a part and everybody can take up the data, the country profiles, and use it in any way they like to advance the cause of young children's development in their countries and their region. As a working group, we're only getting going on this. Our first meeting with the Countdown group, with the country implementation group, is in May, where we'll be working with about 15 countries in West Africa. These are being funded by Gates through the Countdown process. Of course, any opportunities to raise money, to have regional meetings, to have regional events or country events would be welcome. That is how we got the word spread with the Lancet, for those of you who will remember that, is we had launches in some 51 countries. Many of them were funded by UNICEF. Some of them were funded by local NGOs in countries. So I think everybody on the webinar should be thinking about, what can I do in my country? What NGOs, what government resources, what international resources are there to meet around our country profile and ask ourselves questions about what we can do, what we should be improving, etc. I don't know, Bernadette, if you want to add to that.
And no, I think that's very right what you say. In addition, I think as kind of the movement grows and as resources come available, some of the analytics that were done around the last round of country profiles, so we must thank Claudia for that, are already very useful. Linda, you showed this slide which gives the summative figures. So as we move into the future and resources permit, more of these analysis can be done and then can be used as illustrations at regional level, at the country level, and by the media. Just to say that in the past, we did a little qualitative survey to say, what do people see in these countdown? And in that survey, countdown profiles overall, so that was before the ECD country profiles had started. And what we found is that policymakers find it very useful to have comparative data. They look at their own data, but they may then also look, what does my neighbor country do, this, that. So there is a lot of potential there that can be catalyzed. So I think for a large extent, it's in our hands to use this information and opportunities that we have, and then for the collective that's driving the initiative to progressively add on more elements of analysis that helps us to enrich that field of data and enables us to make more powerful messages.
Just to add on to that, the G20 initiative on early childhood development really drew attention to the country profiles. We're asked about why there aren't country profiles for high income countries, given that the purview of the SDGs is all children in all countries, not children only in low and middle income countries. The reason that we don't have that data is because many high-income countries don't conduct things like DA indicated.
Could you repeat
the fact that it came up at the G20.
Linda, I'm so sorry to interrupt. Would you repeat your last sentence? You just froze for a second. Yeah.
Oh, I can see my. Yeah, I can see my bandwidth is going shaky. He asked why rich countries were not doing, did not have country profiles. And the purview of the SDGs is all countries, all children in all countries. And the reason they don't is because they don't conduct standard DHS and mixed surveys. But the interest now is there to do so. And I think the pressure from G20 countries about their own countries will be to begin to produce metrics, perhaps not exactly the same, but metrics that allow them also to monitor early childhood development.
Thanks, Linda. I've just, James, you had a question. If you
are frozen because you're frozen.
James Cox. Okay. There were some questions about people want to participate, and if they want their questions. So one question was specifically about the May meeting that James had asked, would there be scope for local national NGOs or country offices to get involved in those May meetings? Over to you, Linda. Bernadette.
The May meeting is a small meeting convened by Countdown itself. It's going to be a very small meeting of the data hubs to actually begin to look at providing country implementation support. So it's not really the kind of meeting yet to open up to a
okay. Got it.
Platform possibilities.
Got it. Thank you. There's quite a few questions about engagement of the private sector and the public sector, if there are any plans or any initiatives underway. Bernadette, Linda, any of those comments?
This is Bernadette. Well, looking at the question, involvement of the private sector for implementation of the nurturing care framework, very much so. The private sector, if we think about the ecological framework, these green circles that interact with each other, private sector has a key role to play. And somehow we see in the country profile some measure of that when we talk, for example, about maternity protection, because that's typically a policy where private sector needs to engage firmly to make that a reality for countries. There is also within UNICEF leadership around initiative for family-friendly policies that look at maternity protection, childcare facilities that are being offered in the workplace. So these are issues that are very much part of the implementation agenda. And sort of as we continue tracking progress programmatically, we will need to kind of measure that engagement as well. Linda?
That's
Yes, of course, all of, every.
Oh, Linda said her getting shaky.
My bandwidth is really big.
Well, I think this has been a really rich discussion. I've intentionally not gone over the questions that relate to data because, as we mentioned, on April 15th, we will have a deep dive webinar with Claudia Coppa and Nicole and other members of the Countdown team to do a real deep dive in the methodology and the data and get to all these questions. Claudia, I hope you've looked at the Q&A box. There's a whole treasure chest of data questions that we can address. This has been an extremely rich conversation, and it's the first of many series for the Countdown 2030 profiles. This recording will be shared where we'll be able to review the slides and think about this more. We really want to encourage everyone to go to the websites, go look at the profiles, look at what the indicators are, ask your questions, make sure you sign up for the ECDAN mailing list. You can be kept in the loop for the next webinars, and you're part of the movement. So welcome to the movement. You're part of the Nurturing Care Framework movement and Nurturing Care movement. And we really want everyone to feel like you're part of the network, part of building this movement together. So we want to hear from you. We want to hear what you're doing in the countries. We want to showcase it. We want to keep the dialogue going. So thank you very much. It's April 15th for the deep dive. We will be sending out invitations for that. Again, please make sure you've signed up for the mailing list in order to get that. And all of that you can find on ecdan.org. With that said, I want to give a very deep thank you to both Bernadette and Linda for your time and for sharing this and excellent leadership for this. So thank you, everybody. I hope you have a great morning, evening. I know people are joining us from all parts of the world. So thanks, everyone. Yeah, have a great day and see you all soon. Bye, everyone.